Thank you so much. Well, there's no doubt that men have a lot of fears and questions about erectile dysfunction, even though we talk about it a lot more these days. The best bet here, fight those fears with facts. Stop worrying and start learning. That is our message today. Dr. Sonny Sager joins us most Mondays with our Doctor Is In segment, and he brought with him a special guest from St. Louis University Hospital, urologist Dr. Sophia Ford-Glanton. So thank you so much. Let's start talking about the basics here. What is erectile dysfunction and kind of how do we get around it?
So erectile dysfunction, also known as ED, is the inability to achieve and sustain an erection suitable for sexual intercourse. And there's several reasons for this. One is the nerve supply, two is the blood supply, three is the ability of the veins in the penis to trap and keep the blood in there, and fourth is the stimulus from the brain. So there's a number of causes. You've also got to look at obvious causes. As a general internist, I've got to think about other things before I send them to a specialist like Dr. Ford-Glanton, like are they on certain medications that can cause this as a side effect? Are there psychological factors involved? And things like that. So you know, there's also ways to prevent this, like quitting smoking and you know, exercising and eating right, and that advice can be given for almost any medical condition.
The good lifestyle options that we talk about so often.
But then when I'm stuck and I can't get this problem addressed, then I turn them over to Dr. Ford-Glanton.
And when they come to see me, there are a number of options that most men can use for their erectile dysfunction. Everybody has heard of Viagra. That's those type of medications. Is
that what you would try first, something like Viagra or Cialis? Would that be like a first line?
That is a first line treatment, and then if most men have tried that with their primary care doctors as well. And if that doesn't work, they come to see me, and then I have more treatments that I can use, such as a vacuum device, penile injections, or penile prostheses, which is a surgery that I perform to help men achieve erection.
And I know you brought some of these things here, and I have never seen any of these. I'm sure a lot of people at home have not either.
So this is a malleable penile prosthesis. There's no moving parts. The patient is always semi-erect. So basically it's down to urinate, up to have intercourse.
Okay.
This is kind of the Cadillac of the penile prostheses. This is what we call an inflatable penile prosthesis, so it more closely approximates a natural erection. There's this part that goes into the scrotum, and this part which is in the abdomen, the patient never feels or sees this, and then these go into the penis. Patient reaches down to his scrotum, the water from the reservoir goes into the penile prostheses, and it goes from a flaccid state to an erect state.
Does that work for people that may have had prostate cancer and maybe had some perhaps permanent nerve damage? Is that one of the best options or the only option really?
Well, if they don't respond to Viagra or the other treatments, then yes, this is a great option for those patients. This helps them when they don't respond to anything else, and it usually has a high partner satisfaction.
Okay.
So wives or partners are usually very happy with this prostheses as well.
And I want the final question, are men getting more comfortable talking about this? Has all of the advertising with famous people talking about this, has that really helped?
It's definitely better than it was a decade ago.
Yeah.
Definitely, and we're seeing a lot more men come in, and they're even willing to talk to me, a woman. Some men are not as comfortable.
I'm glad you brought that up.
Talking to female physicians about their erectile dysfunction. But I have specialty training in addition to just my urology residency to learn how to put these prostheses in and help my male patients.
Great. Well,
one thing I do want to point out is erectile dysfunction can be a canary in the coal mine for generalized arterial disease.
Oh, okay, sure.
So often we have to think about, is there something else going on? Do I need to send them to a cardiologist? Because there can be a warning light about, you know, maybe
something
my
deeper.
heart, maybe a risk of stroke and other things.
Okay, great. Thank you both for being here. We'll have more information about this on KPLR11.com, and News 11 at noon. We'll be right back.